Okay, I'm back. I apologize, everyone. I was on my DL Instagram at Dana Levenson, but now I am back. So thank you for joining us. I'm Dana Levenson, and this is AskTheDoctor.com. This is our health and wellness series, and we're just going to wait for Sacha El Wakeel to join in just a few moments. Hopefully, he knows to join in, and I apologize that I was on the wrong Instagram account. It happens. I've been live all day, back and forth and back and forth. Here's Sacha right now. We're going to get Sacha on right now. Come on, Sacha. I'm going to try to get him to, there we go. Sacha, you're waiting to get on. We're going to talk about COVID. We're going to talk about recovering from COVID. There you are. Sacha, my apologies.
Hi, Dana. How are you?
Hi, thank you so much. I'm so sorry. I was just telling our viewers that I have been live all day, off and on Instagram. And I was on my personal at Dana Levenson, and I wasn't at Ask the Doctor. So thank you to everyone for having some patience. I am so grateful, first of all, to see you. Grateful that you're speaking with us. I was saying earlier that when we started this health and wellness series, we were trying to give everybody information so that they could live the best life they could while in isolation, and trying to stay healthy and mentally sound. And we've been trying to do that every day at AskTheDoctor.com. But what we haven't done is speak to a COVID survivor. We don't know what life is like for somebody living with COVID and now recovering from COVID. So I'm very grateful that you'll be speaking with us. I hope you're okay to speak candidly about your experience. First and foremost, tell me how you're feeling.
I'm good. Mentally, I'm great. Physically, you probably hear my voice. I'm just getting my voice back. Physically, 60% of the way there. I just started walking like a week ago. So I walk like I'm 80 years old right now.
Wow.
But it's going to take a couple months physically to get back where I was. But, I'm just blessed to be here. So I'm just, happy.
Can you take us back a little bit so we could just get an idea of what this journey has been like for you before I start asking, like just firing off hundreds of questions at you? I don't want to do that. I know
Sure,
we have a long
sure.
time with you. So when did you first feel ill?
It was probably the day before St. Patrick's Day. I wasn't feeling well, and I don't go to the hospital. I haven't been to the doctor besides checkups for, 20 years. I just don't go. But I think Monday, the day before St. Patty's Day, I was starting to feel a little sick. And then a couple days later, I wasn't feeling well at all. But I didn't have any symptoms from COVID. I didn't have a fever. I wasn't coughing or having, issues with breathing. It was more of a stomach pain. So I went to the hospital at St. Joseph's on Thursday of that week. They saw me. They did a COVID test just in case, but they felt like, because I didn't have any symptoms, they said, you have the stomach flu. So I think the following Saturday, a couple of days later, I woke up in the morning and I felt like I got hit by a bus. My whole body was hurting. Again, no fever, not coughing, and then I tried to stand up and I kind of fell down. And that's when I knew something was serious. So I kind of got on the phone. The ambulance came and they took me to St. Joe's.
Why did you feel sick enough for an ambulance? Because you couldn't stand, like you physically
couldn't
get
stand.
up?
I couldn't physically. I was just, my whole body was in pain. It's hard to explain it. It was like my whole body felt like it was just, something was going on. Then I knew it was kind of serious when I was could barely walk. So they came, they picked me up. It kind of felt, it might be COVID because the way they were acting in the ambulance and they were talking, probably because they've probably seen a few cases already. So they took me there to they actually turned the whole area where newborns are born, they turned it into a COVID area.
Mm-hmm.
So I had my own room. And I thought, I'll be there for a couple of days, nothing more. I'll get through this, no problem. And then I think just things I don't really remember. Things just went really, I just kind of blacked out from then on. And then I woke up. Suddenly, I thought I just woke up, and I was in I was in a different room. I was facing down towards the floor, and I had all these tubes everywhere. Like, you name it, there was a tube there.
So you were intubated.
Yeah, I was in ventilate. I had ventilation in my down my throat, so I kind of freaked out. Started pulling some stuff out.
Oh, for sure.
And the doctors and nurses ran in, and they calmed me down. And they didn't really tell me till like a day and a half later. They go to me, they say, hey, do you know what day it is? And obviously I couldn't speak, couldn't write or do anything. They asked me, a day, and they waited for me to get a little stronger. And they're like, do you know what day it is today? And I'm like, in my head, it's March 23rd, March 24th. So I shook my head. I'm like, yeah, I know what day it is. But mentally I was there. Physically, I couldn't speak at all. And then they're like, no, it's April 12th. You've been in a coma for 17 days.
17 days.
Yeah, induced coma. Yeah.
So how long were you in the hospital for, from start to finish?
Over a month. Yeah, I just got out last Monday. Yeah.
You just got out?
Yeah, just Monday the following before. A week from Monday. So I've been out for 8 days.
Okay. So you're in the hospital, you wake up from a coma, and you're alone.
Yeah.
No family.
No family.
In your mind, do you realize that you have COVID and that you are in the hospital and this is very serious? Do you have any awareness as to what's happening to you?
When I think they waited a little bit, but when they explained everything to me, they like slowly told me, this is what's happening. We had to put you in a coma, and then, I couldn't communicate with them. I just could only listen to them because I had ventilators still in my throat. So at the end of the day, it was, they did a great job. The doctors and nurses are just amazing there,
It's nice
But like 10 days ago, I wasn't able to walk. I had 2 people help me stand up. So it's been a process, it's been a process. I had to learn how to kind of eat again because I couldn't have any hard food. I had to drink thick liquids. So I had tests. So they were doing a lot of tests. Like, and unfortunately, we spoke about, because I'm healthy. I don't have asthma. I don't have diabetes. Yes. I have no symptoms. I'm pretty healthy. But after, we spoke to the doctor, and, COVID works is it really tricks your system into telling you your healthy cells are actually bad cells. And so your destroyer cells destroy your healthy cells. And literally what my doctor said, he said it was like a tornado went through my body. Mm-hmm. So I got a blood infection. I had, which I have an IV for that's hooked up to me. Nurse comes every day. I had. I
could hear it. I hear you. Your breathing sounds a little bit labored, like you're taking.
Yeah. I go up a staircase. I breathe pretty hard.
Yeah, I could hear that. So, what people aren't talking about is the idea of people being completely alone in the hospital. And I imagine you must have been scared out of your mind, and you didn't have family with you.
Yeah, my family's not actually here. They're in BC, and they wanted to come. When I was in the hospital, I kind of made a strict rule to my brothers, like I don't want anyone to come.
Yeah. Well, they couldn't come in, right?
And even no one's allowed to see you. Yeah, it's tough because you don't get to see anybody.
May I ask you a hard question?
Sure.
Did you feel at any point that you were dying?
I mean, it's weird. The only thing I can really remember is, when I was not awake, was weird dreams, like something like Inception. I was just getting into darker and darker and darker, kind of like weird scenarios. Can't really explain what they were. And then it kind of just felt pulled up. You asked me if I had 17 days of what I remember. No, I think when I woke up and, I was just blessed. After the doctor spoke to me, I was just happy to be here. Like, I didn't really, at the end of the day, I was just like, okay, when they told me that I was going to be fine and not to worry, I was like, okay, I'm just lucky to be here.
Yeah, exactly.
I'm very blessed. God's good, and lots of prayers and friends. So I was people visiting me was not my priority. It was just like,
Of
okay,
course.
I'm here,
Of course.
they'll get to see me,
Right.
So,
I was reading an Instagram post, and I'm not sure if it is someone you work with, was saying that you needed light and love and prayers, and that
yeah,
people all around were sending you this because they felt that that's what you needed at the time. Did you feel
I
love?
think, I'm not a specific religion,
Right.
my dad's Muslim, my mom's Catholic, never grew up on a certain religion, but and I do believe in God, but yeah, it was, I think, I say the number one factor was God. I think, he made the decision for me to be here. Number two, I think, and I call them my guardian angels, is the nurses and the doctors. They worked tirelessly 24/7 on me. And then third is all the prayers and love. I'm actually overwhelmed. I had, hundreds and hundreds of messages of which I'm still responding to. And I think that was a factor. I think that was a kicker, I always say, because without, I think, so many people praying,
Mm-hmm.
love and support, I don't think, without that I would be here. So I'm very blessed on how much support and love I got, especially in Toronto when I don't have a lot of family.
So
But I actually do. They're all my friends. And
I
I
want
consider them friends.
people who are watching who may not know who you are. Maybe let's talk a little bit about what you founded and what you own, which is Cali Love, which is more than just a restaurant in Toronto. It is one of my favorite spots, and it is a wellness hub. I know it's been referred to as that. And you think about staying well and eating well and exercising, and people are under this impression of, well, I eat really well, I have a great immunity, I have no underlying health factors. Like you said, you don't have asthma, you don't have diabetes, you're not overweight, you're not a smoker. And you're thinking, I'm not going to get COVID. And if I do, big whoop, I'll have a cough. Maybe I'll be uncomfortable for a few days. But that's not true.
No, I think everyone's a little different, and we're seeing that. You see stories of soccer players passing away. You're seeing younger people pass away. I think each person's different. I think people, you gotta have to understand this virus is only 6 or 7 months old. When I spoke to the doctors, obviously I had a lot of questions, and their answer was a lot the same. We're like, we don't know. We don't know. Like when I asked them, like, why did I get so sick? They're like, we really don't know. We don't know enough about this disease, and I think that's what he's trying to explain to me, is like they don't know what it's going to turn into or how it's going to work out. So I think that was the key thing, is there's not enough knowledge on it yet for everyone to just kind of be like, oh, it's just a flu. It's not a flu.
No,
It nearly killed me.
no,
And I look at
it's not.
everybody.
No.
It's not one of these things where I just won't feel sick for a couple of days. It's it's killing people. And it's just not older people. It's killing younger
Exactly.
people as well. So,
Are you comfortable saying how old you are or around?
42, turning 42 this August.
So you are relatively young-ish. You're certainly not in that 70 plus age group.
No,
What do you think the message is? What is the message that people need to hear from a COVID survivor who's young?
I think, just take it, I mean, take it seriously. I think a lot of my friends, when they saw what happened, they totally changed. Speaking to a few of them, they're like, you know what? I saw what happened with you, and I went into like stay at home, not social distancing to a degree, So I think that's the key concern here is, until they find a vaccine, we got to take it very seriously, and I don't even sure if I can catch it again. And when I asked the doctor, I'm like, can I get it again? Because obviously I was paranoid of thinking, I can get it again. And there's cases of that. And he's like, we don't know. Same
I know they
question.
don't know.
They don't
They
know.
don't
So
know.
like I'm treating it, a lot of people are like, well, you had COVID, you can go do whatever you want now. And I'm like,
True.
no, I'm doing the same thing that, everyone else was. I made a mistake. I was out there socializing, thinking exactly what everyone else was thinking. I was like, hey, I'm going to see my friends. there's no way this thing can, hey, I've never been to the hospital. You know, I'm from the mountains. I'm a country boy. Nothing can hurt me, you know, and yeah, it brought me to my knees, you know.
Do you know anyone else who was as sick?
I know people telling me stories about family that were sick. I spoke to a friend today and who owns a SDK, and he had someone who died, a busser who died, who was 30 years old. I spoke to another friend today, and her father is on life support right now. Sorry, not life support, same thing. He's on a ventilator for 2 weeks now, and they don't know if he's going to make it. And the mother just got it as well. I think
Unbelievable. So
I
um,
think people have to understand.
somebody, Deborah, who just wrote in, she just asked, how are you dealing mentally now with the unknown? How do you go forward now?
I think mentally I've never been stronger. I think people always ask me, like, I'm very, you know, people who know me, I get a little anxious and I get, you know, I'm just way more mentally. I think I've been stronger than ever, just because you just call friends and family and you're just happy to be here. Like, I think, you know, when people are complaining about something, I look at them and I'm like, yo, you know, I know you're not making money. I know, you know, you're not going to be able to do this and that. I'm just like, be blessed that you're just here, you know, and I explain that to them.
And so you have as you said, you think at least a few more months of recovery until you are fully back to where.
Yeah, it's more physical. It's more physical now. I mean, I get the IV out May 8th, which is for my blood infection. And then, you know, physically, I'm getting stronger every day a little bit more. I got, like, I was supposed to go to a rehabilitation center for 2-3 weeks, but they wouldn't take any COVID patients. So me and the doctor said, you know, can I work from home if I have the right support? And, you know, so you know, I do every day. Try to do a little bit more. But physically, yeah, I got a ways to go. Like, you know, a week ago, I wasn't able to stand up without two people helping me. Then I had a walker for a couple of days. Then I was walking on my own a little bit. And now, you know, every day is getting a little bit easier.
Sacha, what do you think, or what do you want to say to people at this point in your journey and really out in the world, what's happening everywhere? I think, what do you want people to know about COVID?
I think, well, the first thing, I want everyone to be patient. You know, I think everyone's getting a little eager. I got to work. I got to do this. I mean, it's not worth losing your life or losing someone else's life because you got to wait 2 months or 3 months. I know it's hard. I know it's tough for a lot of people, but I think that the key thing is just patience. Don't 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 be in a rush to get back to being what we were. You know, I think it's a serious problem. And I think everyone's going to be affected by it some way or another, by either knowing somebody or losing somebody in their family or a friend. And I think people need to be just aware of, you know, listening to the rules and trying to just be safe until this goes away. And, you know, and it might be 3-6 months, you know, but, you know, 6 months of your whole life is pretty much nothing, in my opinion.
I agree with you. I do. I absolutely agree with you. And I think that there is not a false sense of security right now, but there's something going on. Maybe it's patience. Maybe you just hit the right word. Maybe it's the lack of patience. I think people are starting to feel like, okay, we've been doing this long enough. Now it's time to just, you know, get to the other side of this. But it certainly isn't time just yet. And it's so important for people like yourself who are brave and have the courage to talk about what they went through and what you're going through right now, because certainly you will be considered a hero to a lot of people by speaking up and speaking out about what it is.
I think I'm just you know, blessed, and I think you know, everyone asked me what, you know, it must have been terrible. I consider it a blessing. You know, I think it brought me to a different, you know, perspective on life. So I consider it a blessing that would happen to me, because I hopefully can help other people. And the true heroes are the doctors and nurses. If you see what they go through on a daily basis what I saw. Like, it fathoms me how hard they work, the hours they work. And I tell you right now, they were ready. They're ready for anything. They were actually underwhelmed when I was there. I was like, "Are you busy?" Like, I asked a lot of questions when my voice kind of got bad, and I started writing a little bit. Um, but they were just saying, "Yeah, we're ready." You know, they were expecting a little bit more.
Mm-hmm.
But they were ready. I think from SARS to this, they didn't want to make that mistake. So, you know, the doctors and nurses to me are like, they're the people I have a ton of more respect for than I
That
ever had.
that makes me happy to hear. My husband is an emergency room physician,
God bless him.
and one of the doctors in a COVID clinic. And it would be, I know he's watching this, and to hear your perspective of care will, it'll make him very happy to hear that the doctors and nurses and frontline workers are there for people, because that is our system. We are very blessed for it. I'm so grateful that you had the courage to come and talk to us, to talk to me today. I hope you feel better every single day, and that you build up your strength every single day. And that one day that we could meet at Cali Love.
Yeah.
am craving.
Yeah, we were sending the doctors and nurses to, well, my partner Dan he was great. They were sending Cali Love to all the doctors and nurses at
You
the
need any
hospitals.
volunteers? If you ever need any volunteers to drop off Cali Love to our doctors, our nurses, and our frontline heroes, call me. I will do
Yeah.
that. It would be my honor.
And then I just tell everyone just quickly, if you see it,
Please.
if you know someone who's a doctor, who's a nurse, just thank them, just thank them. They're just, when it gets tough and when your life's on the line, they're the ones that are right there more than anybody. So, yeah, just blessed that we have a great system. So
I hope people are hearing the message. I hope people are listening and hearing you, and people are aware that this is not gone just yet, and that
and I see a lot of my friends on here, so I want to tell them I love you guys.
that's incredible.
My first live
I'm actually seeing a lot of people here that are thanking you for your story, and thanking you for your courage to talk about what it has been like for you. And there's a lot of people recovering right now that don't want to talk about it. And I think it's important to talk about that side of this journey, so people really understand that it's not just a cough.
No, it's way more than that.
Yeah.
Trust me.
I'm honored that you spoke to me today and came on AskTheDoctor.com. I'm wishing you all the health and happiness in the world. And maybe if it's okay with you, maybe we can check back in a couple of weeks and see how you're doing.
100%.
I think people would really like that.
Yeah. I'll hopefully my voice will be a little better.
Okay.
And, it's great. Thank you, Dana, for having me on.
Thank you, and feel good.
Thank you. Take care. God bless.
Well. Thanks, everyone. Bye-bye.